This session will discuss how the COVID-19 pandemic changed the healthcare industry, how to redefine payment integrity programs to address the new challenges, and best practices to rebuild the space the right way to correct errors and fraud further up the claim continuum. So moving forward into the future, payers need to lean on innovative payment integrity programs to mitigate these risks. So without any further ado, let's jump right into it. And let me start by introducing our panelists who will be speaking with you today. First off, I'm going to introduce Tina Azar, market leader at EXL Health, who has over 22 years of experience in the healthcare industry, focusing on payment integrity and provider strategies. At EXL Health, Tina works to ensure that EXL's products and services drive the most significant value while servicing customers' needs. Using strategic planning and thought leadership, her primary focus is analyzing healthcare insights and trends, and then designing and executing comprehensive and innovative programs. Our second speaker, who works with Tina very closely here at EXL Health, is Erica O'Connor, Senior Assistant Vice President at EXL, and is a highly experienced professional with a diverse and extensive background in payment integrity programs. At EXL Health, Erica brings her many years of Blues experience and unique perspective when solving complex business challenges for her clients. Within her 22 years of healthcare experience, Erica managed the claims payment integrity team for a large health plan located here in the Midwest, where she built an internal payment integrity programs, managed vendors, and created efficient technology solutions. So with that, I'm going to turn it over to Tina to take over now.
Awesome. Thank you, John. If you want to head to the next slide there. Let's go ahead and go on more. I'll just start off by saying I'm pretty confident I don't have to share kind of what the obstacles are in our post-pandemic world with you all. You know, you're living them, you're breathing them day in and day out. And so what I want to do is help quantify where we're hearing the most. I've had an opportunity to speak with many of you during this last year as you guys have been tackling the tough problems. And so I really want to point out where we're hearing the most trends and where we're hearing the most impact to those trends. And then really what we're seeing as successful payers strategies when they're addressing those trends. So hopefully we can run through that today. It's a little bit of a complex story we're putting together today because it's, you know, trends kind of reach broadly across the portfolio of healthcare, but also hoping that this is dialogue in nature. We've got the chat open. If you guys have questions as you go along, please feel free to drop those in the chat. And we're certainly going to open up the mic at the end to kind of hear those questions as well. So just kicking off, I won't call all these out to you, but these are some of the challenges we see in our current state within the healthcare industry. And these are broad, far outside payment integrity, right? These kind of reach all crevices of healthcare industry. Right now, we're seeing where there's just a very large competing priorities for those resources kind of post-pandemic. So it's like we all went into the pandemic with a strategy, with our resources, with our roadmap for our resources, with our plan for our platform enhancements or our platform changes and our vendor shifts. And really the pandemic has shifted a lot of that. And so coming on the other side of that, we're seeing where a lot of those resources just aren't there, or they've shifted to manage priorities that have shifted as well during the pandemic. We're seeing a pretty large workforce shortage still. And I know we talked about this as a nation when it came to our clinicians, and that was commonplace on the nightly news. But where we haven't talked about it a lot is just in the before and after administration around care. And so you'll see, I've worked with payers where their entire data team has completely shifted out. And as you know, they carry an immense amount of knowledge from handling those roles for so long. So that's good content that has really shifted out of their own organizations. And so they're working hard to gap fill that talent. We also see where there's a big push to move to digital solutions, which is great. And we're excited for that. EXL is definitely a digital company. We offer digital offerings in almost everything that we touch. But at the same time, we're seeing where what do you have to sacrifice to be able to implement those digital answers? And sometimes that's costly. So if you're not going in with a candid and fully accurate ROI attached to some of the digital solutions that you're working to implement, that could be pretty painful. We're seeing some things like telehealth really spike, and we're going to spend some time today talking about telehealth. I think that's going to be a big one. And what we're hearing from you all, we're already starting to see it really come to fruition, looking at the mandates that are supposed to be lifted later this year. So we'll spend some time today talking about that too. We also know that traditional provider and payer boundaries have shifted. We're seeing a lot of payer and provider mixes in organizations. And really our customers have shifted along with that as well. We're seeing a lot of excessive uptick in services like lab panels. And that's really increasing in the costs to the overall healthcare industry. And then we're also seeing where we're shifting much more to the value-based solutions. And we're going to talk about that too, just the change in reimbursement models as well. Next slide. All right, this is what I view as one of the stimulus when it comes to thinking about the shifts that we see in the industry, and that is just these massive pieces of legislation that has really come to land. So there's 3 of them that I think are pretty big that are really shifting post-pandemic, especially around anything having to do with the economics of care, which is certainly payment integrity. But one of those is the Bipartisan Safer Communities Act. If you've not heard about that act, I encourage you to read up on it. One of the outputs of that act is that there's going to be about $340 billion put into behavioral health. Most of that's going to be focused on adolescent behavioral health, which is a great thing. I think as a country, we recognized during the pandemic that we really need to up our resources when it comes to BH at large. The problem with that, as you can guess, is that that's typically a piece of inventory and a claims profile that we haven't seen before. And so you're going to see a lot of probably aberrant billing behavior as those behavioral health services come online, very similar to telehealth. Another one is the Inflation Reduction Act. And we're going to continue to see some shifts in how CMS is addressing some of those concerns. And then lastly is just the no surprise billing and price transparency laws. I know that's an older one, right? That started to really come online mid-pandemic. However, as you know, there was a very slow adoption in this country with regards to both those pieces of legislation. And so now, just now, you're really starting to see where payers and providers both are starting to adopt and be compliant with some of those pieces of legislation. And that's really causing a lot of questions around the arbitration packages that come at the tail end of that process, but also how they're addressing those concerns with their members in the form of pre-service call logs. Next slide. One of those areas I want to touch on, I talked about before, is the telehealth trend. And if you haven't looked at your current spend around telehealth, I encourage you to do so. Telehealth has grown over 1,000% during the pandemic. However, what's more alarming is just the CAGR that we have attached to this, right? So over a 5-year period, we're expecting to see about a 44% growth in telehealth services. Don't get me wrong, I love telehealth. I have 5 children. And so for me to be on the road and be able to get services for my kids is priceless to me, right? I can do a lot with the new services and technology that we have picked up as a nation. However, right now, as you know, there is some delays in what we can review in a post-payment audit capacity. And so a lot of those claims are going unregulated. Let's go to the next slide. I just want to show kind of a cost analysis when we're thinking about telehealth. So we expect this curve to ebb down, but what we're seeing right now is that we've kind of touted as telehealth as this service that's going to be a cost saver to the payer and to the provider. But a recent report release showed that in truth, right now, telehealth services are costing just a little bit more per event. And that's important to note because we're really going to want to work as an industry to really ebb down the cost, continue costs, which will probably come in the form of reimbursement changes so that we can really right size what should be a cost efficiency gain to our healthcare system. But right now, it's still pretty costly. And so when you think about the excess in numbers and how much it's grown, and just thinking that that's not a cost saver, it's kind of a double whammy. So when you're thinking about your telehealth services, let's talk about where you can impact those differently. If we go to the next slide. So right now I view that there's about 5 areas that I would definitely make sure that you're looking at when you look at your telehealth claims. Important to note, OIG released a report. It was about the beginning of February, where they showed out of a $6 billion spend during 2022 on telehealth services, about 1.2 billion of it was fraudulent. And so for me, that stat stands out pretty loud and clear that it's something that we need to watch. We know those mandates should be lifted in May. So I would say now's the time to really start doing your homework and doing some data analytics to assess how big of a problem it might be within your own four walls. Maybe it's not at all. But the areas that I would definitely be looking at is I would be looking at where you're seeing a lot of bills billed at the highest level of care. I would also be on the hunt for duplicate claims, which is an area that OIG is finding a lot of. I would say high volume billing, when you're seeing a massive amount of bills per visit within a specific provider group or provider, right? And so you want to partner probably with a vendor that can look at that data across a multi-payer view and understand, is Dr. Smith billing 360 hours a week for telehealth services? And so those things pop up pretty quickly. And those, what we're finding with the telehealth claims is that the bad really shake out pretty quickly as the bad, right? And it's much more clear than what we look at typically from a payment integrity standpoint. Heard a good payer friend of mine report this last week. I couldn't agree more that it's really important for payer organizations to have their never event list. And those are events that they would consider never to be telehealth events. And so, that is a simple data check against your paid claims file to really understand, are you seeing events that are being billed as a telehealth services when they really shouldn't? And then I would pay attention to your DME and your lab tests that are appearing inside your telehealth services. And we're seeing a lot of fraudulent behaviors around those lab services as well. Another trend we're seeing, if we want to go to the next slide, is just talking about home health. So home health also is an area that we're seeing a large growth factor on the other side of pandemic. It's got a growth rate of about 7.8%. But we're seeing really poor documentation out of this area. And we're seeing also where the CMS or the OIG is really focusing on certain attributes of home health care. Let's point out a couple of those if we want to go to the next slide. One of the areas that was pretty surprising to me is that when you look at the home health care, we're seeing that a high propensity of patients in a home health care setting are getting antipsychotic drugs, which is pretty alarming. I think it's an area that they have decided to probe an additional audit on. That's something that, again, would expect to see additional feedback from them coming around May. And that's something that you can look at your own paid claim files to really understand, are you seeing those same attributes out of your home healthcare bills? Most home healthcare are doing compliancy audits, and we typically are looking at the new grouping model for how those claims are paid. What we're finding is that a lot of the home healthcare claims are just missing proper documentation. That means that there's a real opportunity to have provider education in that area, right? And so a lot of those audits are going to net pretty high appeal rates, but at the same time, it gives you an opportunity to really correct behavior, right, when they're submitting those claims and really looking for complete documentation to those claims that support the events. So that's one area that I would certainly be focusing on. Go to the next one. I think we did this one. This is behavioral health. So sorry. So behavioral health, also per the legislation, we're going to see an uptick in behavioral health. I know behavioral health is one of those tough areas for anybody to really attack from a cost containment area. But we are finding where proper policies and event management allows for better economics around the care that's received. And given that it's got a 13.9% growth CAGR, I definitely would advise that you looking at your paid claim files as well in this area. Next slide. Here's some of the areas that you would look at, right? So we're just continuing to see a high level of autism claims inside those BH claims. And again, most of those audits are being looked at from a compliancy audits perspective, making sure that proper documentation was submitted with those claims. The next trend that we see is just a change in reimbursement models. This is a big one for CMS. They've got a very aggressive goal. They're looking to have 100% of traditional Medicare beneficiaries in AC relationships by the close of 2030. And so we know on January 17th, they announced that they've got some initiatives really pushing towards that. They've got about 13.2 million Medicare members that they're really working on that. So what you can expect to see is just a change in those reimbursement models downstream. I think it's going to be very important for your payment integrity programs to really understand how are your contracts and your reimbursement rates and your reimbursement models changing, and really making sure that you're arming either your internal teams with that as well as your downstream vendors with that information so that you can ensure that the audits you're performing are going to net value. And oftentimes I'm finding that you can work with those vendors to really make sure that they're aligning their audit practices behind your initiatives around value-based care. Next slide. The last one I thought we were really kind of moving away from. It felt like we really got a grasp on provider abrasion and how we were viewing appropriate impact into the provider community around aberrant billing behaviors. We had a good feel for what was the normal threshold rate for amount of claims to be selected, and that we were having really good dialogue with the provider community when we were working with. It seems post-pandemic, obviously, we've got new players and new roles, and also just competing priorities that really make those provider abrasions much louder right now. So there's a couple things that we would suggest to do. The first and foremost is to really make sure when you're moving forward with any audit process that you're being proactive in the audits that you're performing. So what this would mean to me is that, if you're turning on a new concept, that you're doing your research behind that concept, you're looking at the providers that are in the inventory, understanding who are going to be most impacted by those audits performed, and then performing outreach, right? You're reaching out to them with a letter saying, this is the audit we've performed. We would like you to know that we have viewed the data and believe that you're going to have some correspondence with us. We want to make sure that you're aware of this and open the dialogue for correct billing behaviors if you so choose. And then really provide transparency and denials. And so right now we're seeing about 17% of the claims that are initially denied by payers. About 50% of those are eventually approved on. And so, how do you kind of close that gap and really make sure that we're not causing unnecessary burdens on the provider community? And so just kind of tweaking the efficiencies around those new features, both from a prior authorization perspective and approval for care, all the way down the continuum until you get to where those claims are being paid. I would say lean on your provider PI vendors, right? If you have somebody that's doing work on your behalf, bring them to the front lines with you. Make sure that you have faith that they are acting as an extension to the spirit of what you're trying to achieve within your network. However, I think it's important to have your SMEs on the call and kind of shorten the conversations. And typically I find that vendors are really good at being able to do that, right? And having conversations with those large health systems. Most of the time, those large health systems are also their customers. And so they have a vested interest in making sure that those conversations are affable. And at the end of the day, that they're standing for clean billing behaviors. And then lastly, I think one that's a really good feature to lean on as well is just provider portals. And so we're seeing that where vendors have strong provider portals for medical record submissions, that's really reducing the amount of abrasion that we're hearing from those payer groups. And I know, Erica, you've had some experience with provider portals and also with having audit programs without provider portals, right? So can you speak on that a little bit and kind of share your thoughts around it?
Sure, absolutely. Yeah, I that's something that's newer that's been coming up, having the portal ability. And I think it's not only super efficient, but also allows the provider to kind of manage things from their own side without having to, play phone tag or go back and forth and try to get the answers that they're looking for. So I think that's really important when you are performing audits that require medical records, itemized bills, all of that paperwork. That reduces the postage, the timeline with mailrooms and getting sorted and all of the paperwork that's involved with that. With a portal, you can have that immediate upload into the system, allowing provider to, like I said, check status of the audit and get confirmation that their record was securely received in order to perform the audit. So something that is very helpful to have, and we've had some great provider response as well.
And then, so Erica, when you talk about the portals, am I viewing this correctly? So it's a portal where you would be submitting medical records, but it's also a portal where the providers would have direct access. So those typical questions that we would have downstream in the form of payment integrity, like where's my appeal? What's the status of my claim? They can self-serve that information through that process.
Absolutely. Yes.
Okay. Got it. All right. Next slide. All right. I want to jump into really quickly something that I've noticed as a pretty large change post-pandemic. And those kind of circulate around 3 areas that I like to call the who, the what, and the how. So I find successful payers are really addressing these issues. They're creating a steering committee, which is the who, right? They're creating an internal steering committee that allows them to have support when they're rolling out their strategies. And so we'll talk about what that feels like. I'd also say the what is really talking about how do you utilize your most important assets, your platform, certainly being one of them. The portal is one that we called out as well, to really leverage the transformation. There's a thought process here that, post-pandemic, we really flattened kind of all the work that we had done in a payment integrity setting over the last years. And so what we're seeing is that people say, we're so close to ground zero. Let's rebuild this the right way. And so understanding how your steering committee and what tools you have in your arsenal are really the step 1 and 2 of that. And then lastly, I say, of course, is the how, right? And that might be a little bit further downstream. We'll spend a little time talking about that today. But let's jump into the who with the next slide here. So I think one of the things that's important to do is really define what payment integrity is. And when you're looking at your payment integrity support or steering committee, it's pretty important to think that payment integrity is just the economics of care. And because insurance is a financial institution, it's a financial industry, pretty much everything touches the economics around that care. So it's important when you're building out your strategies that you really have support from what I see on the left-hand side of this, right, is all of these areas, right, with your IT, your finance, your compliance, your claims, your network management team to really making sure they're aware when you're rolling out new concepts to your providers. Also looking at your customer service teams, making sure they're online for any member support. That's pretty important when it comes to price transparency and no surprise billing. Lots of inbound calls around that, which is what's supposed to happen. Talking about your vendor management team, making sure they're on board with the strategies are rolling, and then legal. And then from there, what you can do is kind of create these sub EPIO teams. And that's where you've got a team that's specifically looking at your payment integrity overall steering committee, and then one that's specifically related to just your coding committee. What are the appropriate codes that you want to adjust to? And looking at one that helps define what are your appropriate key performance indicators. How are you going to measure success within your payment integrity program now? You get another subcommittee that's there to develop insights. So that's going to look very clinical, probably in nature, very code, very tactile in nature, right? And it's a round table of auditors, coders, and probably other clinicians that help define, this is where I'm starting to see claims pop up and where I think that there might be some additional cost containment issues that need to be addressed. And then just your continuous improvement team. That's your roadmap team, right? That has the ability to kind of look downstream on your next 3 to 5 year plan. And what are you going to be tackling next in the area of your cost containment? And then just really root cause troubleshooting big data issues. You want to be super connected to your data team. We talked about the workforce shortages at the beginning of this presentation, and I can tell you that is where I see a lot of movement and a lot of turnover. And when those people walk out, they walk out with a massive amount of knowledge. And so it's really important that you stay connected and foster good relationships with those teams, because you really can't get to the insights you need without them. So pretty important to add them to your committee. And going to the next slide. Also important to define what is payment integrity. I think the definition, I gave a definition to a peer this morning because I feel like this has shifted immensely over the years. We used to think about payment integrity as being this niche service that was way downstream after the claim was paid, after everybody forgot that event, long gone, right? And now that's really shifted, and that we're really thinking about payment integrity is the governance that's really there to reduce the expense overall for the payer. And so that's going to start as soon as prior authorization. Right now, in my world, it starts as soon as prior authorization, right? And so you think about prior authorization, what's the goal of that? To authorize those claims. Well, if you think about payment integrity, where the rubber hits the road, did that claim pay the way that it was authorized? It's a simple question, right? And so looking at those outputs to understand how are we being effective and really early up in the life cycle of those claims is pretty important. Again, all these areas I don't need to call out for you, but I think it's important for you to really kind of look at your own organizations and say, what does payment integrity mean to your organization? You know, do you have a separate entity that's working your adjustment files that sits outside your purview? How do you help kind of bring in your adjustment teams or help encourage them to really address your work, right? Typically those team members are turning the widgets of thousands. And so how do you bring focus to what you're trying to tackle with your strategy? I'd say if you have the ability to kind of look at those, then you have the ability to drill down and understand, you know, who's your vendors or your internal teams that really need to be part of your payment integrity quilt. And so you can think about your preemptive team, your COB team, your prospective teams, your claims editing team, your clinical validation teams, retrospective teams, your fraud, waste, and abuse, SIU teams, and your subrogation teams. So, you know, that is one of the biggest shifts I've seen post-pandemic, because where all of those entities typically were separate and distinct and managed uniquely. And now it feels like there's a real understanding that how those cogs all form together and fit together, and how detrimental it is to not having those cogs turn on the same strategies. And so we're seeing a lot of alignment with those groups now. And again, by doing that, because every single one of those entities that you touch are areas that are also touched by the provider. And so it's, you know, when you get alignment on those areas, we're seeing a real reduction in provider abrasion. And we're seeing maximizing downstream payment integrity outputs, right, in the form of savings. Next slide. All right, the what. So let's talk about some of the digital things that we have. I'm just going to kick it off with the platform, because I'm seeing a lot of movements around platforms, a lot of considerations around platforms. And I agree, your platform can be your largest nemesis, or it can be one of your best tools in your toolbox to really address. I would say looking at your platform, it's important to understand what is going to be your ROI to financial investments that you're working on when you're thinking about a platform switch or an upgrade. I would look at it and take a very proactive approach and understanding what are you able to impact in a pre-submission stage. And I think that's important when you're looking at your platform. You know, what can you hang off it in a year's time, and 2 years time, and 3 years time that enable you to really stop the pay and chase way downstream and really start tackling some of these cost barriers in a pre-submission capacity. You have the ability to really take that then and learn from your data, right? So when you're getting those submissions from those claims and you're able to look at it from a pre-submission venue, you are better able to decision around that and prevent continued downstream impact. You could write policies. You could partner differently with provider education tactics inside those health systems that are heavily sending those claims in. You can also then start to think about how you can develop automation capabilities. So Erica brought up the provider portal, having the ability to have that provider portal feed directly into your platform so that you can get status adjustments and have your audit team or your claims adjustment team have ready work available on their user screens based off of the automation. Also is totally capable. I think you can also create this cycle where you've got self-learning, machine learning, AI learning within your ecosystem, within your platform, which will allow you to really understand from a big data perspective what's happening and the outcomes of your payment integrity program, and what do you need to really lift and shift earlier up the continuum for correction, and how are you going to do that, right? And so I would say that your discussions with your vendors at that point shift. It's no longer, we need you to go chase those dollars down. It's how can you help me stop chasing and make a shift to cleaner billing, which is certainly something they should be capable of. And then I would say you can properly use your talent. You know, I'll take home health for an example here. A very large percentage of home health claims that are audited today, we talked about, are just missing documentation. And the problem with that is that it's going to have a high appeal rate. And the other problem with that is that, you know, you're probably going to have a high overturn rate. Not a terrible thing. What you're doing is correcting bad billing behaviors within your payment integrity ecosystem, right? But it's an awful lot of administrative burden, both from the vendors, from the providers, as well as from your own teams. And so one way to combat that is to really look at that and utilize some of this digitization automation, and then really free up your staff to be able to focus on where you're going to drive the value the most. Okay, next slide. Here's just an example of that. So if you're looking at kind of a real-time rules engine that's detecting billing anomalies, and it's finding those during the claim adjudication, you could stop the claim there and really return it back up to the provider, right? And so legacy today, most platforms are really allowing that to flow through to payment, and then you're addressing that in a post-payment status. The benefit of being able to find that in that use case scenario is that the claims getting audited, the claims correctly getting submitted and paid. So you're avoiding the administrative cost of the audit and recovery. It's costing you about $80 to $150 for every instance. And then the member's liability is going to be calculated correctly from the very beginning. And the provider will have less audit burden downstream. So that's a winning solution. Let's look at the next scenario. Here's another use case. You've got same thing, right? You've got a real-time prepay anomaly detection that's happening in your claims adjudication. And then in your post-payment, you have the ability to identify those billing anomalies. And then you're pushing those all the way back up and having kind of this self-learning life cycle within your payment ecosystem. And that's about 7% of those claims that are being paid incorrectly. So payer gets paid correctly the first time. It's avoiding the administrative burden. Again, it's about $80 to $150 per claim that's touched. And the member's liability was corrected. Next slide. And again, here's the last one, is just where you're being able to pull all of that information clear up into your prior authorization cycle and really connecting the events of care, where you've got your member in your office and really working through that provider authorization and possibly even price transparency, no surprise billing, all of those things that are pre-care events, and really working through that prior to those claims being submitted in the first place. Next slide. All right, so that's really how we are looking to kind of take back control of your payment integrity program. We're hearing a lot about vendor consolidation and looking to shift some of the internal work that you're doing, I would say, pick and choose your vendors wisely. Make sure that you're working to kind of create a centralized audit awareness and steering committee that helps with that. Help with some of the reporting elements that you have, some of the things like provider scorecards is really important to have when you're approaching the provider issue abrasions that you're seeing out there in the marketplace. And then lastly is just really making sure that your vendors have advanced security and that we did see, unfortunately, a very large trend in breaches during the pandemic and post-pandemic. So I think it's pretty important to also always keep a lens now that we've got more movement out there, more digitization, also puts us at risk of just having more breaches. And so really making sure that you're staying tightly with your compliance officers and the workflows that you're creating. Next slide. All right, I'm going to turn this over to Miss Erica, where she can talk. She comes from the payer world. I like to say she was one of you. Now she's one of me. But to kind of run through some of the payment integrity programs that you're facing today.
And payers, and some things that Tina had already highlighted earlier in the deck as well, around difficulties and things that maybe are being focused on post-pandemic. So listed here just some of the things that we've been hearing out there in the world, and mainly how do you get that executive support? There are many things that can pull attention in another direction quickly, or priorities that are kind of reassessed, and things that are given time and resources more than others. So just really trying to tighten up that payment integrity division and continue forward to meet those goals, and get some of those dollars back that you may be asked to bring back to your payer. So experiencing still some disjointed programs and areas of payment integrity. So just trying to highlight those and bring those back in if you need that. Are you getting the analysis and the numbers that you need in order to showcase that and bring that attention to those programs? Tina had highlighted COB, SUBRO, fraud, waste, abuse, your pre-post coding, all of those things. Where do they lie, and are they being incorporated into your reporting that you're showing value for your company? And Tina had highlighted as well that governance, you're tying all areas together is extremely important. And even having just a monthly governance to bring all of those things together, your coders, your clinicians, your analysts, concept people, all across the board, just to make sure that you're maintaining and keeping everyone apprised of what's happening and decisions that are being made. Things like that are important. Also, reporting, and as I mentioned, bringing those things together, being able to pull in all of the areas. Do you have the ability to gather all of those numbers to showcase and bring that to senior leadership in order to showcase that? And maybe there are still pockets where there are PI services happening through the company, but they're not tied in, or they're perhaps doing something that's always been done, and there could be some ways to bring more value, savings, or make some changes there. So just highlighting those two. And then you get it kind of captured in those incidents where you may have people questioning PI programs or provider pushback, so your network team gets really loud. And do you have the information to back that up? So again, provider scorecards, very valuable and important to have in hand and showcase where they may be hitting. Are there, as Tina had mentioned, maybe some documentation, lack of documentation, coding errors, clinical decisioning, or just standard data mining. Where are providers really hitting, and where can you bring attention to that to help maybe change that behavior, and or push policy or put new policy in place? All of those analyses to take place to help you get to a better place with your PI program. And then, the multiple vendors as well can be burdensome if you have many different programs, many different vendors across the board, and the difficulty with managing that. How can you best centralize and ensure that you're getting the best bang for your buck? What are the vendors bringing to the table for you? And what is that costing? What is the ROI out of those programs? Showcasing that as well. Vendor scorecards are helpful too, to show what's happening there, who's being the most effective and bringing the best savings, and who also is, bringing new things to the table. So I know that personally, having a vendor in place for a very long time, it can get very static. So it's always, going back and asking your vendor, what's new, what's on the roadmap, what new cool technologies or digital capabilities do you have that can help further enhance? And then, as Tina mentioned as well, staffing and resources, tools, all of those things, asking, can vendors help with that, right? So it's not just your standard old-fashioned post-pay payment integrity recovery work, but where else could they insert to help? Is it staff augmentation? Is there, analysis, reporting, digital tools, all of those things that vendors have the capability to do. So when you think about, where you're lacking or where you may need assistance, reach out, use your vendor as an arm, an extension of your business, if they can plug in other places as well, not just your standard payment integrity program approach. All right, next slide. And just some other things I'm thinking about. So maximizing on your payment integrity business, not just the recoveries, but other things that have come up over the last few years. So I know a lot of plans had initiated that ASO, self-insured business billing shared savings model. So if you haven't taken advantage of that yet, that is a really good thing to put in place. It not only, provides transparency to your groups of what you're doing, and kind of boasting about your payment integrity program, but also giving you a bit of a break when you share those fees, share the fees with those services with your plan. It's also helpful now with the host mandates that have been put into place to include those into that reporting as well, and showcase what's happening, across the spectrum of blues when there are so many groups that are outstate or, provider services that happen outstate. And then also we have the host claim recovery fee billing that was put into place as well with your programs that are hitting on the host claims. So are you including all host claims in your recoveries? Just ensuring that you're covering all bases, multiple vendors and passes in place to make sure that as many of those host claims that, are you reporting and invoicing other plans for that and sharing that information, and then, ingesting those paybacks into your reporting for your payment integrity division. Do you have a P&L to showcase that? And then, individually for each program, how is that successful, or how is that adding to the value of your payment integrity program? And then also thinking about the vendor stack. So you're managing multiple vendors, but also you're thinking about the value of having a multiple vendor stack. So having, typically most people want to have an internal payment integrity team and then an external vendor, but also thinking about stacking the vendors to ensure, nothing is missed, that you're getting the most value that you can out of your internal and vended programs, to help, further build either your internal program or further build your savings out, so that, like I said, you're fully maximizing and getting all of the value out of these programs. And then also, are there any programs maybe you haven't gotten into yet? Is there a savings program that's not on your docket today that could bring really good savings and value to your program? And, you know, are vendors bringing forward new ideas and concepts to you to, analyzing your data to see if they can add more savings in there? So adding that competition in there, pushing on your vendors to bring more to the table, more solutions, digital capabilities, technologies, all of those things, really leaning on the vendor to see what else they can add for value.
No, I think that's right. I would just comment on something you said with regards to the vendors. And I think, one of the things that I've noted as a change, we talked about the provider operation and bringing your providers to the forefront and to be on the front lines with you. They should carry some of that weight, right? They're causing the work that's contributing to it. But I also think that the veil is kind of dropped around roadmaps. And so I would encourage you to share your roadmap of your strategies with your vendors. And you would probably be surprised where there's probably synergies there that they can discuss with you, or see how their roadmap shifts. Every vendor has a real want and need to stay aligned to the strategies and the shifts within the payer ecosystem. And they're also really good at advising you if that roadmap item might be no longer of value by the time that you get it launched, or that, that item of initiative is going to be much more costly than the value you see from the outputs just based on our experience. So they have an ability to kind of have a multi-vendor or payer view to really help advise on that. So I think that's one of the biggest things that I've seen drop is just this holding the cards so close to the chest that we can't co-work on strategies together.
Absolutely.
All right.
All right.
Well, that brings to our last slide here, which is really wrapping up the information that has been just so wonderfully presented here by Tina and Erica here. And we want to make sure that we just touch on, how do you make the most of your teams and the efficiencies that they can gain, and really looking for innovation and smart platforms to maximize the value that your very important people in your payment integrity programs really are performing today. And there are a lot of trends out there that we covered today, such things as the shifting regulatory landscape, for example. There's a lot of change coming into there, and we talked about the importance of staying in touch with your compliance teams and working them into your teams in payment integrity. Telehealth is growing rapidly. I'm sure all of you are seeing that out there today. This is creating a large amount of growth and almost a new focus, if you will, on how do you manage the rules around telehealth. The geriatric aging population, that's growing. That's not going to slow down. So you're going to see a lot of the unique attributes that come in from that type of a population, and the claims and the audits that are needed to manage that. But really, the change in reimbursement models is going to help, but it still requires a lot of expertise in management to keep up with the regulations. And the important thing is that we hear all of the health plans out there that we talk to is to say, we value the teams on our payment integrity panels, and we really are looking for innovation and technologies to make everybody more efficient. So we would love to hear from you all on what are you seeing out there, and perhaps you might have some questions that we can answer now for our panel. So I'm going to turn it over to opening it up to questions. Molly, I don't know if we have any questions that you're fielding that from our folks, or feel free, everybody, to open up your microphones and ask a question directly.
Absolutely. So there's a chat functionality down below. Excuse me. So feel free to enter any questions in that chat. Otherwise, we do have our first one. What was the largest impact to post-pandemic to the payment integrity industry?
Well, I'll take the first stab at that, and then Erica, you can certainly chime in. From my perspective, is just the shifting of priorities. Like I said, heading into the pandemic, everybody really had the strategy that they were drilling on, and we had probably neck deep in contracting work and platform decisions and all of that. But really, the pandemic shifted a lot of those priorities, and it felt like at large we gave a pause, appropriate so where needed, and then really work to kind of pick up what our next shift in priorities. So where we are really focusing on how to create a more efficient world in post-pandemic. Now some of those attributes around aberrant billing behaviors have changed. And it feels like there's a much larger shift into digitization and just really doing more with less human capital and being more efficient through digitization with what we're doing. Erica, same?
Yeah, absolutely. I would say ditto. For sure, the pause on a lot of programs as we were coming into the pandemic and there were so many unknowns, and then getting those jump started again, right? So kind of reevaluating that program and starting again and running into the staffing issues. Facilities maybe don't have the administrative folks they did before, or you lost, some of your payment integrity SMEs and experts, and how do you pick that back up again? And it's definitely been the do more with less situation across the board for payers and providers. So managing through that and kind of picking and choosing your battles of getting things reestablished again, for sure.
Beautiful, thank you. Second question, what information do you recommend having included in your scorecards?
That's a good one. Erica, this is a big project of yours, so I'm gonna let you take this one first.
It is
Erica's
absolutely. So I'm thinking you're speaking of provider scorecards, because I had vendor scorecards too in the past. But for provider scorecard, it's really having that snapshot of a one-stop shop, right? Like not too much information, but enough information to showcase kind of a rating. So you will think about the data that you want to have as part of a scoring. So where might they be hitting on certain concepts? Where they may have a high hit rate on, maybe incorrect coding, and that could be an area for them to focus. But then also, where are they doing well? So maybe they don't
Great
have
point.
as many clinical type of concepts that are hitting, or data mining, they seem to be performing well. So it's just kind of gauging across the spectrum, here's your total amount of claims that you had, and here's your billed amount and your paid amount, and then here are where our PI concepts are hitting in that space. And then also including in administrative things, like here's the number of medical records we've requested, here are the number that were received in certain time frame, 30 days, whatever time frame you want to use to showcase that. And maybe here are records that were not received, so there might be a case of technical denial. So it's all about that partnership with the provider and showcasing to them where they're doing well, where there may be areas that could be improved, and the total dollar factor as well. What they're being paid, where you're hitting on recoveries. So kind of encompassing all of that, and then having that scaling or score, I guess you would say, of where they're falling in comparison to their peers is helpful as well. So maybe that another facility that's very close proximity of paid and services is doing much better in that space, or maybe they're doing worse. So kind of leveling where they're at across the provider community as well. Those are some things that I would incorporate into that provider scorecard.
I think those are all dead on. I think I would add, if you're able to, I like a waterfall to really start with the first echelon, right? Which to me is your total spend. Like a lot of times we're talking in payment integrity, we're talking about 0.01% of the claims selected, right? Which nets $340 billion of savings throughout the year. And so, but if you look at that comparison to the total spend at that provider, it really helps put things in perspective to say, okay, very large health system, I understand that it's annoying to handle 50 audits, a quarter with us. However, your total spend is X. And that really does kind of change the dialogue. I would also say, I really like Erica's concept around making sure that you're trying to come to the table in partnership. I think you're going to find that you get more gains if you stand tall on just correcting aberrant billing behavior. And so if you have the ability to also call out where they're doing that successfully and saying you're doing great here comparative to your peer groups within the industry, that's a really important feature to have as well. Is there another question?
We do not have any more questions, and we are also at time. So if anyone was unable to ask a question, absolutely feel free to reach out to either us here at EXL or your association partners. So Brianna, Ioana, thank you so much for joining, and we will absolutely be able to provide any answers, after this call. So again, thank you for joining. And if you do have questions or want to discuss more, absolutely feel free to contact us.
Thank you guys so much.
Thank you, everyone.
Thank you, guys.
Thank you.